Welcome to Burlap Teachers. Enjoy the video.
You start by gathering essentials: the Caresens meter, a fresh vial of strips, sterile lancets, and a charged battery or fresh cells. You check expirations and strip integrity. This prevents invalid readings. Once done, wash and dry your hands thoroughly. Moisture skews results. You load one test strip into the meter until it clicks. The device will indicate it is ready. Make sure the lancet is set to a comfortable depth before you arm it, so you're prepared for the first poke. Now you obtain the blood sample with care. You choose the side of a fingertip. Warming it for 10-20 seconds increases circulation and reduces pain. Once pricked, you form a small drop, roughly 0.5 to 1. 0 microliter, too little gives errors, too much is wasteful. You must avoid heavy milking because tissue fluid alters the value. Then you bring the strip to the drop, not the other way around. The meter will confirm proper application and begin analyzing immediately. Finish by reading and recording the numeric result. If you use an app, sync now so trends remain accurate. You log context, time, recent meds, and whether you were fasting, because interpretation depends on it. Once done, safely dispose of the lancet and keep strips sealed. If a reading seems off, try a control solution test. Make sure strips are inserted correctly and batteries have adequate voltage. If errors persist, replace the strip vial or contact support, then retest to confirm.
Thanks for watching. Consider subscribing if this video helped you.